On today's episode of What's My Body Telling Me, I speak with Amna, a psychotherapist and mother who spent years with heavy periods, hair loss, fatigue, and autoimmune thyroid symptoms, only to be told it was just anxiety or her weight. This is the raw and relatable story of a woman who was ignored and misdiagnosed multiple times, who refused to be labelled or dismissed, and who ultimately chose to listen to her body, not just the blood tests, taking an integrative approach that finally helped her feel well again. So whether you feel like you've been dismissed by the medical system, live with chronic symptoms no one seems to understand, or you've been told you're fine when you're anything but, this one is for you. Amna, thank you so much for coming on the What's My Body Telling Me podcast this morning. I just wanted to start by asking, why did you want to come on this podcast and share your story?
I wanted to come on this podcast and share my story because I feel it is very important to talk about this because I know I'm not the only one experiencing it. So this conversation helps a lot of people as it has helped me hearing other people's story and kind of feel like, oh yeah, I'm not alone in this.
The power of feeling like you're not going crazy, even though you might not have had answers and you can see that other people are experiencing it is an amazing thing. So where did your health challenges begin?
So my health challenges, I would say, have been going on since puberty, but they were never really addressed. And when I say puberty, I mean, I've always had heavy periods. And then I had, when I was giving my A-levels exam, which I'm not sure what's the equivalent to here, probably HSCs, but equivalent to Australian standards, my periods were delayed and there were no answers to it. Doctor suggested me going on hormonal medication to kind of get the period started, but they had no answers. Or they also put me, when I did finally go to the doctor for heavy bleeding, because it was getting to a point that I had to lie down or it impacted my everyday activities. And the solution they gave was a painkiller, which helps with kind of reduce the bleeding. And then they also put me on birth control pills, which wasn't really doing anything there. And I was also put onto this medication, which, because this was all back in Pakistan, I was also put on medication which is used for insulin management in diabetic patients. So I was also put on that, kind of saying you need to reduce weight, but not really telling me directly, but kind of putting me on that. And the impacts of that medication were just horrendous that I could not carry on with it. And I just stopped taking those medications. But, fast forwarding to now, when I went to doctor recently as well, that was the doctor's solution as well. Oh, go on birth control pills. I don't want to do that.
So you mentioned that you were experiencing the heavy periods and then you experienced side effects of the other medications. What were the other symptoms that you were experiencing?
Side effects of the medications were I was literally shaking, like tremors, throwing up, because that was basically to bring my insulin levels, rise my insulin levels, basically drop my sugar level. Yeah, basically drop my sugar levels. So that's what was happening. So that's something has been happening in the background. I just want to add that in the last couple of years, my health it's been all over the place. I have had every other illness that has impacted me to the point that I was dragging my body from day to day. And when I started going to the doctor last year, where I started getting mouth ulcers. So from mouth ulcers, it was something else like fatigue, hair fall, massive hair fall, which wasn't paid attention to. And yes, my own neglect as well, whereas I got my bloods done, but I never went back to get them checked. And when the bloods were checked in 2022, last year, August, my TSH levels were at 42.
Wow. And for reference, in Australia, within the normal range, the top level is 4 in Australia, and yours was 42, which is very, very high.
It is very high. And my GP's response was, this could be, not even could be, this is indicating towards autoimmune disease, Hashimoto, full stop.
Mm-hmm.
And anyways, and then I had a low iron, low vitamin D. Anyways, I got infusion done, and that's when I started seeing a naturopath because I wasn't getting anywhere with a GP.
Mm-hmm. So what's it been like not getting clear answers from the healthcare system?
Very frustrating. It makes you really angry because there are layers to it. For me, I'm an immigrant, so I have been in Australia since 2016. However, I've never been to the doctors. I think the first time I probably went to the doctor was when I felt pregnant with my son, when I conceived. And even then, my experience was like, the first initial appointments with the GP were pretty horrendous. So I didn't understand the system at first, that how does it work? So that was pretty overwhelming. And because I didn't have my residency at the time, I needed to have a private healthcare, and a lot of GPs don't even understand how do they need to refer someone with a private healthcare. Or even if they do, they don't understand, like they can be pretty wobbly around it. Like, for example, when I was sent for a test, they didn't say I had private health insurance. They said I was paying it out of pocket. So a test that was supposed to cost me like $15, or that my insurance was going to cover or whatever, that was costing me like $100. And I literally had to spend a few hours with the insurance, GP's receptionist, and kind of go back and forth to get that corrected. So the frustration with the medical system is just next level. And now when I was to the point where I'm not getting answers, like even recently, GPs have no answers. And when I went back this time, I said, well, I'm still struggling with fatigue. And I was like, could you please give me a referral to a specialist to see, what do you call them?
An endocrinologist?
Endocrinologist, yes. And she was like, no, sorry, I can't do it because your TSH levels are okay. And I was like, but my thyroid autoantibodies are not. They're way out of range. And she said, oh, yeah, they're positive, but we can't do anything at this stage. And I'm like, so what do I do? One's doctor's suggestion was, oh, you're overweight. He did not weigh me. He just looked at me and said, you're overweight. And he commented, oh, it could be anxiety. You're a psychotherapist yourself. Work on your anxiety.
Mm.
And then the last GP, which was a female, she said, look, your BMI, she asked me my weight. At least she did that math. She asked me my weight. She asked me my height. And she said she calculated my BMI, which again, something I don't believe in. And she said, I think I'll need you to put on like weight losing medication, and that would help. Like, no, thank you.
Mm. And I guess that's the thing. Exactly what you've just explained is why I started doing what I'm doing. Because I started out as a chiropractor and you yourself are a psychotherapist, you just mentioned. So we see people as a chiropractor, are seeing people mainly for musculoskeletal things, and you would see people mainly for mental things. But we know that the whole body is connected. And you would see people that are, I'm anxious, but you can also see that, they're possibly overweight and they also don't exercise and their diet isn't good and maybe they're insulin resistant, and that's going to be impacting their blood sugar levels, which impacts their mind, but also maybe they're not nourished enough and that's impacting it. So we can see that the healthcare system is amazing at the way it's set up is amazing at treating the acute illnesses and the chronic end stage ones where it's like you actually need this medication to survive. Like your organs can't actually perform the tasks that they were designed to do because there's been so much prolonged damage. It's amazing for that. But when we're in this space where you found yourself, where you're like, I'm in this mishmash, I feel like I'm in a washing machine of I have no idea what's going on, and someone just tells me, oh, it's an autoimmune thing, here you go. And you're like, yeah, but why? Why do I have it? What is my body trying to tell me with these? And maybe I am overweight with a BMI, but that's a symptom. The weight is a symptom.
Yeah, that is a symptom. And the other thing I wanted to, kind of put in there, which I think I missed, that after my TSH level went to 43 or something, they went back into normal. And the doctor
After doing anything in particular or nothing?
No,
you didn't change anything?
Just nothing. And my symptoms were still same. Heavy hair fall, fatigue, low energy, very sleepy, struggling, low immunity, getting very sick very often. And my doctor was like, well, TSH levels are fine. We don't need to worry. I don't know why that result was there. And I was like, I need answers.
Mm.
But they had no
This
answers.
is the thing that I've actually been trying to figure out how to explain in a way that is validating, but it doesn't keep you stuck in a health reality. So what I mean by that is, when we go to the doctor, we want them to tell us answers. Sometimes when we've been stuck in this, I don't know what's going on, it can feel nice when someone goes, here you go, you've got this autoimmune condition, here's a diagnosis. It can, in one instance, feel like it's like, oh, amazing, I'm not going crazy. But then it can sometimes feel like, okay, well, now I have this condition and I have to alter everything around my life to acknowledge that that's what I have. But then that actually creates our future reality. I've experienced that myself and see a lot of patients that we're seeking answers. We want the doctor to be able to give us a diagnosis. Because in one part, it's like, oh my gosh, I'm not going crazy. You're not telling me that, oh, it's just because I'm anxious, or it's just because I'm overweight, or it's just because I have these things and that's my problem. And if I fix that, then it'll stop my hair falling out. Then it'll stop me feeling fatigued. Then it'll stop me doing all these things. So when someone can go, oh, your TSH levels are out of range and you have antibodies, here you go, you have this diagnosis of an autoimmune thyroid condition. In one aspect, it's like, oh my gosh, thank goodness, I'm not just making it up. I'm not crazy. I'm being validated by something. But the thing is, when we use these tools, these medical tools, which are designed to tell us whether you need medication or surgery to survive, it is really, really confusing, because if we're not out of range, then they go, there's nothing wrong. But we're not going to pay attention to the fact that you still feel like your hair's falling out, you're fatigued, you can't lose weight, you've got all of that, you've got dry skin, you've got brittle nails, your gut's playing up and all these things. But on this test, everything's fine. So you're fine. It's like, so that is where, when we rely on something external, a external validation tool to tell us, yes, there is something wrong or there isn't, that's where we can get into trouble, because that's where we make ourselves out to be wrong, or we feel like we're going crazy, or it's just like we're, for lack of a better phrase, pushing shit uphill. We feel like, please listen to me, please listen to me. And it feels like no one's listening to us.
Yeah,
But
exactly.
they're just listening in a different language. They're listening for, I want you to be really bad, because then I can help you. I can help you with surgery and medication. But if I can't help you, then there's nothing wrong. And that's what I realized from studying the medical side. I'm like, oh my gosh, right. Okay. The whole way we use the healthcare system is messed up, because what we need to do is go, okay, this is how my body is feeling. These are the symptoms that it's giving me. I can trust them because I'm experiencing them, full stop. And then we go, okay, what do I do now? How can I go and get help from the different types of healthcare? So the medical, the functional, the energetic, and they're all really important, but we use our body to tell us. So even if a test has said there's nothing wrong, it doesn't mean we're crazy. It doesn't mean that it's just because of anxiety. It doesn't mean those things. It goes, oh, okay, what do I actually want to create? And why is my body giving me all of these different symptoms?
Yes.
Okay, let's just go and reverse engineer and go, my body's actually helping me. I know I don't want to have this excess weight. I would prefer not to, but this is telling me something. What is that? Well, I know I don't want my hair to be falling out. I know I don't want to be feeling fatigued, but what is it trying to tell me with these things? And we can get curious instead of like, I have to have someone else tell me that there's an issue, because then I can finally go, oh yes, my body isn't crazy.
Yeah. And the other side is that because I'm a psychotherapist, so what I look at is that the body is not showing those symptoms out of nowhere. There's a reason why when I'm anxious, it's impacting my gut. Or when my gut is impacted, oh, maybe it's anxiety. That's what I need to look into. Or even my doctor just throwing it out, oh, it's autoimmune disease. I knew what an autoimmune disease is. I knew what Hashimoto was, but I was wondering if, and that is quite like, I think it was very irresponsible of the doctor to say that, because that could have been very anxiety provoking, and probably was for me to some extent as well. But to even go like, look, okay, this is happening. Maybe you need to look out to maybe go see yes, you're a psychotherapist, but maybe you need some mental health professional as well. Or you need to see alternative. I feel like the medical system is also very closed, that they don't even refer you to these other people or other professionals that can help you. if they can't. Would you agree?
And I think from when I was originally trained as a chiropractor and that's sort of on the outskirts of the medical fraternity, I very much had that same belief. And then when I studied within the medical system, I realized that for the most part, and this is everyone is individual, so I can't necessarily make a sweeping general statement, but from the training that I received, it was amazing training. But a lot of it was you check people based on these certain test parameters. And if they don't meet them, then they think there is nothing wrong. Like there is nothing that we can do. But then simultaneously, it's sort of like this weird cognitive dissonance that, for instance, an example is something like PCOS, which is polycystic ovarian syndrome, which sounds like based on when you were doing your A levels or your HSC or VCE in the final years of high school when you lost your period and they put you on that blood sugar medication, it sounds like that's what they thought you had because that's often a treatment that they use for PCOS.
Yes, yes.
A lot of the times now they're like, oh, the best thing to do for PCOS is lifestyle changes. Often the thing that they go, do this, and yes, we'll give you a contraceptive pill to quote unquote regulate your periods, which isn't actually doing it, but they do acknowledge we do need to do lifestyle things. So there is this sort of cognitive dissonance of like, if there's nothing that shows up in the test, there's nothing wrong, there's nothing you can do. But then also it's sort of like, oh, well, you sort of need to look after your health and lifestyle, but that's sort of like up to you. And we're not going to really give you any clear indication of what to do.
Yeah.
Other than like, oh, you need to lose weight. I know what to do. And what's in my toolkit is medication or surgery. So you need to lose weight. Here's a gastric sleeve. Here's a lap band surgery. Here's an Ozempic. Here's a different medication that can help with that. And in some cases that is needed and it helps a lot of people, but it's usually not the first port of call. And I think that's the thing that we're sort of alluding to here is that the medical field isn't necessarily the be all and end all. If they say that there's nothing wrong, it doesn't mean that there isn't anything wrong. It just means you need to use a different method.
Yeah, and I think I don't even blame the doctors because I know that's what their training is. Like they can't do anything different from what their training is. So the system is probably needs to be changed how the doctors are trained. My sister, 4 of my sisters are doctors, 3 of my sisters are doctors. And so in their 5 to 6 years of degree of studying medicine, there was one module where they studied how to talk to your client, how to talk to your patient, like one tiny module. Whereas they probably needed like an entire term just teaching them, counseling.
And and I think that speaks to the power of how everything is linked, because how someone thinks about a diagnosis or thinks about their body or thinks about their health is going to impact their health. And again, cognitive dissonance, they know this. What is that? Placebo effect. It's like randomized control trials, whether we think something's going to work or it doesn't, that impacts the efficacy of it. So that's really cool. So what led you to explore the alternative approach to your health? You mentioned that you started seeing a naturopath.
Yeah, so I work with an organization called Quest for Life. I'm not sure if you have heard of it or not, but it's based in Bandanoon and they have residential courses. So I work with them as a counselor. So they have, when people come for the residential courses there, they have counseling because it's quite personal and things can come up. It's related to mental health and stuff. I'm usually on that program and they also have a naturopath on the program to kind of help people that when you have medical health issues, I should say, you also need counseling. You also need maybe trying to look into naturopath. And that was my first interaction. Okay, what is naturopathy? I had no idea. And the founder of the organization, if I'm not wrong, Patria King herself has training in naturopathy. So that was my kind of introduction to naturopathy. And when last year I was struggling and I wasn't getting anywhere with the doctors, so I just rang up my colleague who works there. I was like, well, I would probably need to book an appointment with you and kind of have a conversation with what's going on. And so I had like a 1 hour initial consultation to kind of see if it's, something I'll be interested in. And so it was an hour and it was pretty extensive. Like she asked me every single thing from childhood up till now in regards to my health. And the things that kind of she pointed out. And I was like, oh yeah, this makes sense. I want to give this a go. So this is how I was inclined towards kind of look into, well, I'm not getting any answers from the doctors. Maybe let's try this.
You know your body better than anyone. So why do your test results say everything's normal when you don't feel normal? Fatigue, bloating, period pain, mood swings, anxiety, these aren't random. Your body isn't broken, and these symptoms aren't just something you have to live with. They're signals that something deeper is going on. That's where Test Your Fundamentals comes in. Using a hair tissue mineral analysis, or HTMA, this test gives you a 3-month report card of how your body's been functioning, internally and externally. It shows you exactly what's happening beneath the surface, so you can stop guessing and start listening to your body in a different way. Unlike standard blood tests, HTMA reveals nutrient imbalances, heavy metal exposure, and deficiencies that could be impacting your energy, hormones, metabolism, and mental clarity. It doesn't just tell you what's happening, it tells you why. With Test Your Fundamentals, you'll get a personalized HTMA test, an easy to understand breakdown of your results, access to practitioner quality supplements tailored to your body's needs, and lifestyle recommendations to support all 4 of your fundamentals, so you can take action that actually makes a difference. If you've been told that everything looks fine, but you know something isn't right, it's time to dig deeper. Visit femalefundamentals.com.au to order your Test Your Fundamentals hair test today. There's also a link in the show notes. It's not what's wrong with me, it's what's my body trying to tell me.
And I love that where you mentioned that she looked way back into childhood and what's happening. I have this analogy of the body in that what we've experienced and maybe the diagnosis that we have, it's like a map. Our body is a map and our symptoms are the compass. So if we are experiencing different symptoms, they're telling us that we're sort of off course with what's happening in our life.
Yeah, and it goes back to my own learning, which is that the body keeps a score. Already. Yeah. So the body keeps a score. So that's basically that our body remembers. It stores a lot of trauma that we have gone through. And I'm talking, from mental health point of view. But then our mental health is not any different from physical health. They're both linked.
Every single thing in the body is linked. And that's sort of what I was alluding to before, and you could probably speak to this a lot more as a psychotherapist, where when we do receive a diagnosis, we have to be careful to go, yes, okay, I'm validated, but also we don't necessarily want to make that part of our identity, because when it's part of our identity, then that's completely shifting the future reality that we want to create for ourselves, and it can sort of keep us stuck in this disease loop as well.
Absolutely. And that is why I don't believe in labeling of the mental health disorders as well. But again, it is similar with my clients that some people feel a relief. Well, I have answers to all the questions I've had. And some people are like, I don't need a label. I'm like, yeah, I don't want to give you a label, because that label, it said something along the lines which I loved, was that our body is showing symptoms. I've forgotten what exactly you said, but it was in regards to that. What are we? Sorry, I'll let you finish that.
Well, but I just think of a diagnosis is an easy way to explain something, so then everyone sort of understands what you're talking about. So in my book, I say, well, we could say you have a broken arm. That's a diagnosis, broken arm.
Yes.
Or we could say, oh, I fell over and I hit my arm, and now all of a sudden it looks a bit displaced and it really hurts and I can't use it. That's a really long way of saying I have a broken arm. So the symptoms of a broken arm are it's painful, I can't use it, it's typically after a trauma, all of these different things. So it's the same with, say, for instance, Hashimoto's thyroiditis. It's an easy way for health practitioners and people that possibly experience it to go, oh, okay, I know that this person hits these parameters on a blood test, and also they're probably experiencing fatigue, relentless exhaustion, difficulty losing weight, their hair's falling out, they've got dry skin, they've got all these different things. So I can probably presume that they have these symptoms. It doesn't tell me why. It's just making it really easy for me to understand and communicate.
Exactly. Yes. And that's where I come from. It's like, yeah, okay, that defines it. And I'm just going to put it on a shelf. And going back to what you said, it's that disorder, that disease is not your entire identity. It's just like something that we can put on the shelf.
Exactly. And it's really, really important, because when we shape identity, from my understanding of functional neurology, obviously I'm not a psychotherapist, but when we take things on as an identity piece, that is changing what we believe about ourselves. It's changing our actions. It's changing how we are actually showing up in the world. And when we change that, that can actually take us down a path of, well, we're going to continue down this disease, or we can go, oh, okay, that's just a label given to me, but that doesn't mean that it's not changeable. I can actually change that, and I can move in this other direction. I can use my compass to keep me on that track instead of the other track.
Yeah, and it's also kind of, I love this saying of saying, I have a disease, but I am not my disease. I have a body, I am not my body, to kind of get that distinction that, okay, this is going on, but this is not my entire identity.
Yeah, that's amazing. That's really, really amazing. So what major changes in your lifestyle do you feel like have made the biggest difference?
So first of all, I worked on my gut health. So I went on a medication program for about 3 months, and I realized, and it was funny that I didn't realize my gut health wasn't really good until I went on medication and saw the changes. Well, that feels a lot better, or that's different, it feels. And when I say that, what I'm trying to say is there wasn't that bloated feeling that I used to get earlier, or there was TMI, but even just the bowel movements were different, which you can tell that, oh, this is a lot healthier to what was going on there. That was the first thing I did. And then from there, I went on to doing, working on my immunity and my thyroid functioning. So I've been on medications to help with my thyroid, and that has been really good in terms of managing my fatigue level. But then alongside, I was also looking into my diet, not having certain foods, like, for example, things that have nitrate, I think was it, which is in like meat deli products, not having any of that, watching out my sleep, something I've struggled for a very long time, but worked on it previously. So in kind of incorporating that, and I noticed when making sure that I was getting adequate sleep, how was that impacting me? So I was doing that. And then recently I also started physical exercise, like regularly, and doing portion control and eating more protein, and kind of looking at that was included in my naturopathy plan, but I wasn't really religiously following it until I had another professional with me recently, which is a physical trainer, who kind of specifically guides me with that. So doing that alongside. But then also I was looking at my zinc levels, my vitamin D levels, and it's hard for me to explain this, but my iron level was dropping, and I know I'm like, because there are components of it. So there was one component of it which was on the borderline. And again, GP wasn't worried about it. She was like, we'll see when it drops. But my naturopath got me on the medication that it doesn't go below that. So, because otherwise I would start feeling what I was feeling earlier. So this is what I was doing. And then I'm also, I don't know if my immunity has been low, or because I have a 4-year-old son who brings all the jumps from daycare, that I've been quite sick during the winter months. Like, I've had flu after flu, or very long kind of flu symptoms and stuff. So I was taking medications for that, again with the naturopath, and kind of working. And then even noticing that I was at a point where GP was suggesting I go for an antibiotic, which I didn't want to, because I knew I would have to work on my gut again then. My naturopath gave me like nasal, those, I don't even know what they're called, but what you put through your nostrils, kind of rinse them. But they were antibiotic. They had antibiotic elements to it, but they were targeting just the area instead of my gut. Does it make sense?
Yeah,
And I
sounds like a
saw,
very smart naturopath.
yeah, and it was, and it was amazing how huge of a difference it made. And I was like, wow, I didn't know this stuff existed.
Let's take a little body break. For now, soften your eyes. Whether they're open or closed, Just notice the air entering your nose. No need to force anything, just observe. Can you feel the air a little cooler on the way in and warmer on the way out? This is a reminder your body's been here the whole time, quietly showing up for you.
I think there's a couple of really important things that you mentioned there when you were going back to, I didn't actually realize, for instance, with how your bowel habits changed. You didn't actually realize that there was an issue with them, because I think, and that speaks to what I speak about in the book. I call them green flags, beige flags, and red flags from our body. Our symptoms and how we feel are constantly giving us feedback of whether we're doing things that the body likes or it doesn't like. But unfortunately, we can become normalized to the beige flags, which are the things where it's like, well, you don't need medication or surgery. And a lot of people feel them, or I feel them all the time. So that must be normal. It's a green flag. It's a good thing from our body, but I only use my bowels once every 2 days, or it's a bit hard to go, or I always feel a little bit bloated. It's like, that's actually not healthy. That's a sign that your body's trying to tell you something. It's a beige flag. It's not a green flag. This is amazing. You use them effortlessly. They're formed really well. You use them several times a day. Your appetite is strong. It's like, that's actually a really great sign from the body, but we don't know that. And that speaks to going, wow, actually the mental side of things and understanding what is actually a sign from your body that you're giving it everything that it needs. And also going, that is actually possible for me. Because I think a lot of people, when we have been struggling with chronic conditions and experiencing these things, we can often feel like that level of health isn't possible for me. We can have that sort of limiting belief about ourselves. And it's, I guess I want to say what I would say to those people, but I want to hear what you would say to those people that possibly think this level of health isn't attainable to me. So say, for instance, in your case, if you could fast forward to future you, and possibly that version of you is feeling all the things you want to feel. You feel amazing. You feel energized. You sleep really well. You have amazing immunity. Your weight is well regulated by yourself. Your blood tests are all within normal. You're feeling amazing. How do you feel about that being a possibility for you now?
It seems achievable because it's like I've got a taste of it. Even with the illnesses that I've had, I have noticed I was still able to, when I was really, really sick, I was still not as depleted as when didn't have any seeming symptoms of flu or whatever, but I was just struggling. So now it seems achievable. Now it seems like, there's stuff happening with my body. And even if it is Hashimoto or it is going towards it, well, I'm working to kind of keep it at bay, or not keeping it at bay, but kind of managing that, whatever that looks like. Or maybe even not, because I don't have the diagnosis as yet. And this is what I'm working towards, that probably is not going to be the case, because I am making sure it doesn't get to that. Does it make sense?
It's like it's underneath that is sort of that belief of the body is always adapting, and it can adapt whichever way it needs to keep us thriving to the best of its ability. That's amazing. So the biggest differences for you notice is obviously you increase your protein, you change a little bit of things in your diet, more physical movement, doing specific targeted supplements with the naturopath, it sounds like, and also having some medications as well.
Yes.
Yeah. And I think that's amazing to hear, because a lot of people, sometimes we use I call it, you use your body, not your bias, to make decisions. So it's really important when we can do that versus when we use our bias and not our body. Because I don't know about you as a psychotherapist, but as a chiropractor, I would see people that would come in at the very end. They were experiencing physical symptoms for a really long time. And you walk in the room and they've got their arms folded and they're like, I don't want to be here. But my wife or someone in their life has sort of convinced them to come in. Yeah. And then they come in and then they feel so much better. They're like, oh my gosh, why did I delay this for so long? Because I had this bias that chiropractors are XYZ. So we can have that against any health profession. We could be someone that's like, I hate medicine. I have this bias against them, or psychotherapy or energy work or whatever it is. And we can have that bias.
Yeah, and that is why I always say that I don't feel that towards the doctors. They are doing their job and they're probably a lot of under pressure. Like, to the point, I was listening to this podcast, which was from a naturopathy as well, that was telling that GPs are audited if they're asking for too many results or too many blood tests, which Medicare like doesn't allow or something. And which was like, wow. So it's kind. So I also come from that point that it's not towards the doctors or a profession certainly, and so I'm very mindful of not having that bias kind of come in. It needs to be kind of looked at holistically, and probably the system is flawed, not the doctors. It's just how they're trained with things.
100%. Everyone gets into what they're doing to help people. They're
Absolutely.
not working against you. They're working
Yeah.
within their means. Yeah, that's a really important point to make.
Yeah. And another thing I would like to add is that I have also seen significant improvement in my PMS. My PMS, which was probably a lot worse before, it's so much more manageable now. And first time in, what am I talking, so around in 2010 or 2011, where my periods were kind of getting delayed or all of that. Only recently, in the past couple of months, it has happened that they are kind of, so if they were ranging from, like, the average cycle was from 34 to 30 days, now it's coming within the range of 28 days to 30 days, which is huge for me. Even though my bleeding is probably still heavy, but I am not as fatigued as I used to be, which is just massive for me.
It's when you have more energy, you have more energy for your whole life. And
Absolutely.
that's when we have health struggles, it impacts every aspect of our life.
Yeah.
Our relationships, how we show up to work, our ability to earn money, our relationships with our children, with ourselves, being able to connect with people, wanting to go out and socialize because you're thinking, I actually will have energy after this, versus going, I'm already depleted and this is going to deplete me more and I should just rest. But then you've got the guilt and the going, well, I want to live my life, but I feel like I can't. So it's all of these different things that go into it.
Yeah, and there is this, I feel like women is especially mums, are such a vast majority where they need that energy, but they don't have that energy. And when they go to the doctors, they're gaslit. Yeah, pretty sad.
So what would you say to women that are feeling like they're struggling to get proper care or they don't feel like they're getting answers? What would you say to someone like that now?
So I'll highly recommend them to keep paying attention to what their body's trying to tell them. And if your GP is not listening to you, maybe you need to change a GP until you find the right one. And would recommend going to a female GP. Not always the best, but looking for one. And there are integrative GPs as well who work with your naturopath. So basically what I'm trying to say is listen to your symptoms and don't let anybody else tell you that, oh, what you're feeling is incorrect, because you have authority over your body. And then look out for the professionals that aligns with you, that you believe in would be helpful, but kind of look at more holistically, kind of get that help. And then other thing is that the treatments can be expensive, which goes out of Medicare or naturopathy and stuff. But then if you could look at it as an investment, and maybe you want to look at it in a way, okay, where in my life I can cut down to kind of put that investment here, because that is going to be something that will pay you off in the upcoming years. So this would be my recommendation. Listen to your body. Don't give up. Keep looking for somebody until they listen to you, and look at it as an investment, even if it has to be out the pocket cost. But then again, I would also suggest, ask the practitioners. A lot of practitioners are happy to give you like what do you call, a discounted rates. I do them myself. I always suggest, yes, not every practitioner can, but it doesn't hurt to ask if you're struggling financially.
I think that is an amazing way to finish off the episode, and amazing information. Thank you so much, Amna, for sharing your story. It's one that I know a lot of women will be able to resonate with, and I'm excited to hear how the rest of your journey pans out and to be able to see you and hear you going, oh, I'm listening to my body and I'm trusting it. I think that is an amazing gift you've given yourself and helped other women realize too. So thank you.
Yeah, thank you. It's been beautiful speaking to yourself. And like I said earlier, I want it to be a way of awareness and opening those conversations. And maybe somebody else there, working with their thyroid and have no answers could be helpful for them.
Amazing. Thank you.
You're welcome.
If this episode resonated and you feel like you're stuck in the space between symptoms and solutions, you're not alone. I've been there too, and that's why I created all of this. From the book, if you're just starting to listen, or the test if you want clarity your bloods couldn't give you, or the body-led experience if you've tried doing it all and still feel flat. Well, sometimes you need something specific, like one of our symptoms series for a deep dive support on topics like fatigue and menopause. So wherever you start, just know your body's already guiding you. Share this with someone who needs it, and don't forget to follow and rate the show. Please remember, this episode is for educational purposes only. Always consult a qualified health practitioner before making any medical decisions. Every body is different, and so is every healing journey.